Welcome back. On a day we've administered 2 crore jabs, it feels good to queue up Sanjeevni, a shot of life. And there's more good news. Top government sources say 1 crore doses of the Zydus vaccine, which is the world's first plasmid DNA vaccine for COVID-19, is expected to hit the market at the end of the month or the beginning of October, so not so long there. The needle-free DNA vaccine, Zycov-D, can also be administered to children and adolescents, but only after the green light from experts in India. Government officials say the supply of vaccine has increased phenomenally and is expected to pick up even further in the coming months. Runjun Sharma back with us on the phone line. Runjun, more good news on a really good day for mission vaccination.
Yes, Anand. And what this good news also means is that the pace of the vaccination will further be boosted. Why? Because these are 1 crore vaccine doses of Zycov-D that we are talking about that are expected to hit the market by the end of the month or the beginning of the next month. Remember, a portion of Zycov-D, the 3-dose needle-free vaccine, also is going to be used in the age groups of 12 to 18 as adolescents. By the next week sometime is when we're expecting the government to come out with a list of comorbidities, because remember, initially, it's not going to be for all adolescents. It's going to be prioritized by the government of India. An expert panel has been working on it. Remember, next week, like I said, Anand, is when we'll expect that list of which adolescents will qualify at the beginning for the vaccinations. But it is big news that 1 crore doses of the much-awaited world's first DNA vaccine will hit the market. Hopefully, the pace of the vaccination then also is going to be further increased, and the ultimate goal of vaccinating the entire adult population by 31st of December, it looks more and more real and possible now, Anand.
Well, absolutely. Thank you. Thank you for your inputs, Runjun. May there be more continued good news. And Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine, Indraprastha Apollo Hospitals, is with us. Dr. Chatterjee, good to have you with us on a momentous day.
It's a really good day for all of us. So if the momentum is maintained like this, I hope that we can achieve the target at the earliest, because that is the only way out of this pandemic. Otherwise, we are in trouble. If we can achieve this, then at least there is some relief from this pandemic.
Well, the other aspect is if we put our mind and heart to it, and this is work done by the states, because we're given to understand only 3% of the administration of these doses is in private facilities. It's all primary healthcare centers run by the government across the states that is who are administering these jabs. So we've got a very strong, robust system in place, which, if puts its mind to it, can do this.
Yeah, definitely. See, we have been a country who have immunized so many things for different diseases. So we always knew that we are very good at vaccination. That is what we always used to claim. So once the vaccines are available and the systems are in place, we are in a position to vaccinate the maximum number of people in the entire world, because our country is tuned to it. We have eradicated so many diseases from our country. So we from day one have been telling that we have the experience, we have the expertise, we have everything with us. It has to just start working.
True, absolutely. And in less than 30 minutes, more than 6.6 lakh jabs have been administered. We crossed the 2 crore mark at 5:08 p.m. It's 5:37 on my clock, and we are at 2 crore, nearing 2 crore 7 lakh jabs. So 7 lakh jabs in just about 30 minutes. So that's the pace. So the pace is still on. So we may just get to about 2.5 crore, if not closer to the 3 crore mark today, Dr. Chatterjee.
Yeah. It's really heartening to see these figures, because if we can do that, as I said, the healthcare system has been really under pressure, under burden during this entire pandemic, and we were always expecting a third wave will come to the northern part of the southern part of the country. Unfortunately, has lots of cases. The northern part still is doing much better. I just hope that we can escape this wave if we can obviously do the vaccination and follow the COVID appropriate behavior.
True, Kerala's cases seem to be coming down a bit, so that's a little welcome. But the other aspect is, do you believe that vaccine hesitancy is a thing of the past now? And we'll also now have a lot of the second doses. those who are due for the second dose, especially if they've taken Covishield and that 80-day mark is done, because majority were administered Covishield. So the number or the ratio of those going for their second dose will also now pick up?
Oh, it has picked up definitely. I would agree with you that vaccine hesitancy has gone down significantly. We had vaccine hesitancy even amongst healthcare workers to begin with, but now it has gone down significantly. People are actually talking about boosters nowadays as to how they can get the boosters, which booster could be effective. They're talking about boosters nowadays. So the vaccine hesitancy definitely has gone down over the last couple of months.
True, but one more aspect is in terms of the indications, what you're seeing. We just had the update that Zycov-D 1 crore doses will be available, so which can be administered to adolescents between 12 to 18, and those doses should be available by the end of the month, or if not, by the first week of October. But do you also believe that even if everybody gets one jab, that itself will give them a certain level of protection from long COVID, or COVID that would really lead to certain other comorbidities or other, serious case as threat to life?
Yeah, even one jab is at least it gives you some immunity. Plus, we have also acquired immunity over so many months. So one jab would give you some immunity, but obviously doesn't give you a significant protection, but it definitely gives you protection. There's no doubt about that. So at least if one jab can be given, we can be at least a bit self-assured, or that the intensity of the disease that would happen or the numbers of cases that would happen would be slightly reduced. But yes, obviously the target is to give at least 2 jabs.
The other aspect is, do you see a change in the patients that you see? Those who have got 2 vaccinations, are they complaining less? I know there will be a few cases of COVID coming through even after the vaccines, but what is the significant difference between, let's say, in April, May, June, and now in August, September?
See, actually what is happening is Delhi, that where I practice and where I see cases, number of cases has gone down so significantly. It has so down that all the other cases have come up, like the dengue has come up, influenza A has come up. So we hardly see any cases of COVID. I saw a COVID case only 3 days back. There were 3 in the family who got COVID, but the number of cases have come down significantly. That I am nowadays seeing patients of COVID much less than what I used to do maybe a couple of months back. So Delhi, fortunately, is doing very well. So our exposure to even COVID vaccines, COVID patients has reduced significantly in the last couple of weeks.
Well, thank you for joining us, Dr. Chatterjee, on a momentous day, and kudos to you and the entire team and fraternity of healthcare workers for the yeoman service that they have actually rendered for the people. And also kudos to those who have stepped out to take the vaccines. Taking a very, very short break. Stay with us here on CNN News 18.